Good morning, everyone, and thank you for registering for the Parkinson's Forum 2022. I am Sarah, one of the physiotherapists in Singapore General Hospital, and I will be speaking on the topic of exercise across the different stages of Parkinson's disease. During this talk, I will be explaining the importance of exercise in Parkinson's disease, as well as the different types of exercises suitable for patients with Parkinson's disease, as well as the exercise goals for the different stages of Parkinson's disease, and some safety tips for your exercise program. Before we dive into the agenda, let's have a quick recap of what Parkinson's disease is. Parkinson's disease is a progressive neurological disorder affecting automatic movement. And this is due to the reduction in production of a chemical messenger called dopamine in the substantia nigra, allowing for smooth, coordinated function of the body's muscle and movement. Medications such as levodopa are given to reduce the motor symptoms of Parkinson's disease. Although Parkinson's disease cannot be cured and medications can help to significantly improve your symptoms, how does exercise come into play? Firstly, it slows down the progression of the condition. It also reduces the fall risk as exercise improves your postural reflexes. It is also possible to have a good to great quality of life with Parkinson's disease. Parkinson's disease also experience non-motor symptoms such as mood and constipation, in which exercise can help to improve. How effective are these exercises on people diagnosed with Parkinson's disease? This paper summarizes the results of different studies on how physical activity benefited patients with Parkinson's disease. As seen from these conclusions made by the papers, exercise has shown to improve physical function, quality of life, strength, balance, and activities of daily living. Here is a poster published by the Parkinson's Foundation in America with the recommended dosage for each type of exercise, which I'm going to enlarge in the next slide. These are the 4 types of exercises that you can perform. Firstly, aerobic exercises. These exercises are suitable to be performed 3 days a week for at least 30 minutes. So these exercises are preferably performed in moderate to vigorous intensity. Types of aerobic exercises includes brisk walking, swimming, attending aerobics classes, or cycling. Secondly, strength exercises. These exercises are suitable to be performed 2 to 3 days per week, but take into consideration that these days are not to be consecutive, and exercises should be performed for at least 30 minutes. The strength exercises should target major muscle groups of the upper and lower limb, and these exercises can be using of the resistance band, machines, or even body weight. For balance exercises, it is suitable to be performed 2 to 3 days per week with daily integration if possible. So these exercises include multi-directional stepping, some weight shifting exercises, yoga, tai chi, dance, as well as boxing. Flexibility exercises are to be performed more than 2 to 3 days per week, and actually it is preferably recommended to be performed daily. So these exercises include a sustained stretch with deep breathing, Dynamic stretching before exercise is recommended. These are the types of exercises that you can perform outdoors. So you can see the person climbing stairs. This is a type of aerobic exercise. In the fitness corner at the void deck, you can look at this machine over here, which you can use for your strength training. For multi-directional stepping, balance exercises such as stepping on a step board is recommended. And lastly, stretch your mind. Okay, so next we'll go into the different exercises for different stages of Parkinson's. So exercise is for everyone. For the first two stages, it refers to the early stage of Parkinson's disease where symptoms include tremors, clumsiness, and slowed movement. At this stage, maintenance of fitness is necessary and all 4 types of exercises are recommended. For stage 3, where the symptoms are affecting both sides of the body, activities of daily living such as walking, bathing, changing clothes will take a longer time to perform. You realize that at this stage, truncal muscles are also stiff. And this is where you will need to practice your movement strategies to help improve your mobility, especially during your off time. You can also continue to build strength, aerobic capacity, and improve your balance during the on time. At the later stages of the disease, you may require some assistance in your activities of daily living, and you may also require assistive devices to move around. And at this stage, you can still continue with exercises and you can engage the help of a caregiver for safety purposes. And these exercises will focus maintaining physical function as well as flexibility. During your exercise, these are some safety tips that you can take note. So do ensure that your Parkinson's medication is taken 30 minutes to an hour before you perform your exercise program. If you have any difficulty or experience difficulty performing your exercises on your own, make sure that you have a caregiver with you. So stop exercise if you experience the following conditions. Firstly, the frequency of freezing of gait is a high risk of falls. Second, if you experience low blood pressure after taking Parkinson's medication. Thirdly, if you experience an abnormal heart rate response during exercise. And lastly, if you experience pain and swelling in the joints. And you can consult your physiotherapist for a full functional evaluation and recommendation if in doubt. Here are some useful links that you can look through. So these useful video links are uploaded on YouTube and filmed by our staff. So these links include strength training, flexibility training, and balance training, which you can incorporate in your exercise program. I will end off with a quote from Michael J. Fox. We do not have any choice whether or not we have Parkinson's, but we are surrounded by millions of choices that will make our lives better. And thank you everyone for your time.